What would you do if your child was sick but you could not afford to go to the doctor? For many Americans, this is a reality that they face every day. I'm here to persuade you today that free health care is a right for all children in America. As a mother of a toddler who has asthma, allergies, and sees a speech therapist and an occupational therapist several times a month, I don't know what I would do without my son's insurance. Today we will be looking at the differences between America and other industrialized countries, how free healthcare would reduce the child mortality rates in America, and how healthcare improves the lives of children and their families. America is the only industrialized country in the world that lacks a universal healthcare system. In a study conducted on 11 countries in 2017 by the Commonwealth Fund, the United States was ranked last overall on providing equally accessible and high quality healthcare. In America, we have Medicaid programs that insure children. However, for a child to receive those benefits, their parents must be considered low income. The Your Texas Benefit website states that a family of four can only bring home $34,846 a year before taxes to qualify. As a parent of a child on Medicaid, I know that there are several hoops you have to jump through to receive benefits. Not to mention that often services, medications, and procedures are denied coverage because they're seen as unnecessary. For example, my son has a speech delay, but Medicaid often denies his speech therapy because it's seen as unnecessary. I must either pay out of pocket or go without services. Childhood death is not something we like to mention, but it is a reality we face every day. Infants lose their lives to SIDS, and teenagers die in freak accidents. What would you do if you knew that having access to free health coverage could have saved many of those lives? The World Health Organization estimates that across the world, 6.2 million children under the age of 15 die every year, and more than half of those deaths could have been prevented with proper interventions. However, many parents can't afford those interventions. Something as simple as proper health care for children has a possibility to reduce childhood death rates and improve the health of underinsured and uninsured children. The government census website states that 5.5% of children under the age of 19 were uninsured, largely because of the decline of public coverage. With a decline in public coverage, we started to see more sick and dying children because of the lack of ability to pay for fees. The only way to guarantee that the children in America have access to fair health coverage is for the government to provide insurance for all children, which equates to less childhood deaths and a lower mortality rate across America. In conclusion, I want to remind you that the United States is the only first world country that lacks a universal healthcare system, and that must change, if not for you, then for the future of our children. Without change, we will continue to see children die from treatable diseases and illnesses. Uninsured children suffer every day because of the lack of resources. As a mother, I want to implore you to please stand up for the children of America and their right to healthcare coverage. And remember that the children of today will lead us tomorrow, but they can't do that if they're not around. Thank you.